This is right kidney, grade 2 hydronephrosis in a male patient with acute right flank pain. We see dilatation of the calyces and the pelvis, and upper ureter is also dilated. The upper ureter here is seen by ultrasound. We don't see any stone. To know whether the stone in the ureter is in the upper ureter or in the lower ureter, we can look here in the right lower quadrant by a transverse section. Here we see the right iliac vessels. This is the artery and this is the vein. If the stone is in the lower ureter, we see a dilated ureter anterior, immediately anterior to the iliac artery. This is the dilated ureter when it crosses the iliac vessels. Of course, the iliac vessels most of the time are not seen directly by the ultrasound probe unless we slightly push in this area to make the small bowel loops slide away from between the anterior abdominal wall and the iliac vessels. We can differentiate between the artery and the vein when we push and see how the iliac vein is collapsible by pushing This is the iliac vein. We see how it is collapsing when we push by the transducer on this area. First, to see these structures by pushing away the small bowel loops and the gas contents for an acoustic window to these structures, and second, we see that the vein is easily identified from the artery. This is the artery and this is the dilated ureter anterior to them. This is the dilated ureter. It is always seen anterior to the artery and vein. The ureter here in this point crosses the iliac vessels in the retroperitoneal space. This is an important anatomic point and the landmark to see the ureter. Hereby sliding transversely in this point, we see how the ureter is crossing the right iliac vessels from the lateral aspect of the vessels to the deep pelvis. We slide the probe from here to here with pressure on the abdomen, and we see the iliac vessels and the dilated ureter anterior to them crossing immediately anterior to the iliac artery, going deep in the pelvis. We don't see any stone till this point, so the stone is in the lower ureter. Sometimes the stone lodges here in this point because it is a normal narrow point of the ureter physiologically, and by scanning longitudinally we see how the ureter is crossing the artery. This is the dilated ureter, and this is the iliac artery, and this is the vein. We can confirm the vessels and identify them by color Doppler. We see the pulsation of the artery and the continuous flow of the vein, which is in blue. And here by transverse section, in this point we see the artery and vein and the dilated ureter anterior to them. Here we can see that the anterior abdominal wall is directly anterior to the ureter and the vessels as we pushed it while examining, and we don't see any small bowel between them. The small bowel are pushed away from the area. So if we find hydronephrosis, we can identify a stone in the lower ureter, sometimes in the point where the ureter crosses the iliac vessels, because it is a usual point where the stone is lodged. But most of the time, stones are in the lower ureter, and we see that the ureter is dilated in the point where it crosses the iliac vessels.